Gait development. Normal children begin to walk between the ages of 12 and 14 months. The baby observed in the video appears to be this age and displays normal gait patterns for a new walker. All characteristics of gait in an early walker are aimed to improve balance and stability. The baby in the video is observed walking around a carpeted room, appearing to walk in the direction of a toy or to a parent. He walks in a waddle-like movement with his hands held high, moving freely out of rhythm with his legs. He holds his hands up high in a bent and guarded position to assist with navigation and balance. He walks with a very wide base, taking frequent short steps with little leg and hip extension. He steps with flat feet with his toes pointed outwards, and each step appears to be independent from the next. There is minimal to no trunk rotation. Cephaloconda principle. According to this principle, the children begin to perfect motor skills in a descending order. They are first able to control their head, then arms and legs last. This applies to the child in the video because his control of his head and arms allow him to stay balanced in an erect position. Control of his head and arms are the main factors that also control the line of movement the baby intends to go. During the early years, there can be some obvious gait abnormalities in children. While many of these disturbances are quite common and correct themselves over time, some can be a cause for concern. Antalgic gait is a type of gait caused by pain. Children will show signs of reduced time spent weight-bearing on the affected side. There are a number of possible causes for this presentation, but this type of gait could be associated with JIA, which is juvenile idiopathic arthritis. Physical constraints. Strength affects new walkers' gait because leg must be able to move alternately and have enough strength to support themselves on a single limb. This is evidenced when a baby is able to maintain balance on one leg. An additional constraint is vision. At 6 months of age, infants' visual systems perceive adequate detail to assist them with tasks. Evidence has also demonstrated that infants have functioning depth perception by as early as 1 month. A study of babies between 9 and 14 months old showed they would not step onto a piece of glass covering a perceived cliff, even when being beckoned by their mothers from the other side. In the video of the 30-month-old toddler, she is seen walking with varying pace around a room chasing various toys. The child is more developed and hands are at the waist level. Arm swing is frequent, however still irregular, with both arms being seen going forward or backward together at times. There is a decreased base of support compared to the infant. This happens because stability is less desirable and mobility is more desirable. Stride length increases, reflecting greater application of force and a greater leg extension at push-off. Planting the foot flat on the ground changes to the heel then forefoot pattern, resulting in an increased range of motion. The child reflects great improvements of fine motor skills and coordination compared to the previous video. Proximodistal principle. According to this principle, adolescent development of motor function also proceeds from the center of the body outward. A child's fine motor function of arms develop before their hands or fingers. This is evidenced by the girl in the video as she utilizes her core and arms to swiftly and precisely change direction while still maintaining balance. When the child goes to pick up the toys in the video, her movements slow down and concentration is solely on the task. Toe walking gait with absent heel contact. During the video, the child displayed multiple presentations when her gait changed to toe walking. Toe walking is common in children up to 3 years of age. However, persistent toe walking is observed in spastic upper motor neuron neurological diseases and can be an early indicator of cerebral palsy. As children age and mature, hand-eye coordination and fine motor skills continually improve through adolescence. A constraint demonstrated in the video of the child was a task constraint. The person in the room was throwing her toys at varying speeds, making it more difficult for the child to catch, as opposed to a constant, consistent speed of the toys. In the video of the adult male, he is seen pacing back and forth in a rhythmic cadence and is simulating the body in a perfect walking form of the gait cycle. His arms are extended position maintained at the sides. He adopts the double knee lock pattern to assist in full range of leg motion. In this pattern, the knee extends at heel strike, flexes slightly as the body weight moves forward over the supporting leg, and then extends once more at push-off. His pelvis rotates to allow the full range of leg motion and oppositional movement of the upper torso compared to the lower core. A gait cycle involves a period of weight-bearing, stance, and an interval of self-advancement, which is swing. During the normal gait cycle, approximately 60% of the time is spent in stance and 40% in swing. Exact duration varies with walking speed. Stance. This is to allow progression while also maintaining weight-bearing stability. The lower extremities perform 5 distinct movements that describes stance. Initial contact. Normal occurrence as observed in the video is the adult heel striking with the foot at a 25-degree angle to the floor. The ankle is in a neutral position, the knee extended with 5 degrees of flexion, and the hip is flexed at approximately 30 degrees. Although this is a momentary posture, it is significant because it influences on subsequent knee action. Loading response. The goal of this stance is to support body weight, ensuring limb stability while still permitting progression in the desired line of movement. This is accomplished by the ankle dropping to 10 degrees of plantar flexion from initial contact. Knee flexion extends to 15 degrees, and the hip remains flexed at approximately 30 degrees. The purpose of mid-stance is to advance the body and limb over a stationary foot. This is accomplished by the ankle displaying a rocking motion with gradual dorsiflexion to 10 degrees. As the heel rises, it initiates the next phase of stance. Knee flexion increases slightly and reaches its maximum of 18 degrees as single limb support is initiated, and the hip has progressive decline in hip flexion, and entry into extension allows the trunk to remain erect while the limb becomes more vertical. Terminal stance. The goal is to promote forward progression by generating a propulsive force. The ankle reverts back to plantar flexion from dorsiflexion in a neutral position, creating a rocking motion to propel forward. The knee begins to flex to support body weight of the forward moving opposite limb, and passive extension of the hip joint continues as the body weight advances beyond the supporting limb, reaching 10 degrees of hyperextension. In pre-swing, floor contact by the other foot initiates a terminal of double support, allowing transfer of body weight to the opposite limb to begin swing. The ankle has a rapid plantar flexion to 20 degrees, although there is no major weight-bearing obligation because the primary load is on the other foot. The knee undergoes passive flexion to 40 degrees, and the hip joint initiates recovery from hyperextension to neutral. Swing, the second portion of the gait cycle. Swing has 3 distinct phases and involves lifting the foot from the ground and limb advancement in preparation for stance. Initial swing. The goal of initial swing is for the body to recover from a trailing posture in order to advance the limb. The hip flexes to 20 degrees from the neutral position attained at toe off. The knee continues to flex to 60 degrees so the toe is able to clear the foot, and dorsiflexion of the ankle is initiated. Mid-swing. The goal is to continue limb advancement and make necessary changes for foot clearance. The hip reaches a maximum flexion of 30 degrees. The knee extends passively to aid in the advancement of the leg and foot. By the end of mid-swing, knee flexion equals 30 degrees. Neutral positioning of the ankle from dorsiflexion is accomplished and then maintained. Terminal swing. In the final phase of swing, advancement is terminated and the limb is prepared for stance. The 30-degree hip flexion is maintained, extension of the knee continues to neutral, and the ankle will continue neutral dorsiflexion to basic posture in preparation for stance. This completes the full gait cycle for a normal adult and was observed by the man walking in the video. Newton's third law of motion is the law of action and reaction. It explains the nature of the forces between two interacting objects. According to the law, the force exerted by object A upon object B is equal in magnitude and opposite direction to the force exerted by object B upon object A. This principle is demonstrated in the video by the man's arm swing oppositional of the movement in his legs. Myopathic gait. Hip girdle muscles are responsible for keeping the pelvis level when walking. If there is weakness on one side, it will lead to a drop in the pelvis on the opposite side while walking. This is also called the Trendelenburg sign. This gait is seen in individuals with muscular dystrophy. Major constraints that affect growth and maturation in adulthood are individual and environmental constraints. Individual constraints can be self-esteem or what someone is motivated by. Environmental constraints can be from family, friends, or societal norms. The fear of not fitting in or being liked can affect and alter the maturation of someone's motor development. In the video of the elder woman walking back and forth across a tiled floor, obvious degenerative process can be seen compared to the video of the young man walking. Stride length is significantly shorter, she walks in a shuffling pattern, barely allowing for foot clearance in between cycles. and strength and energy expenditures appear to be an obvious issue. Toes have reverted back to an outward stance, there is reduced degree of angle extension, and pelvic rotation is diminished. Pace of walk also appears significantly slower. Dynamic walking. The dynamic walking approach considers how passive dynamics can govern an entire gait cycle. This principle applies to locomotion generated primarily by the passive dynamics and less powerful leg movements. This principle applies to older adulthood because older adults can modify their gait to accommodate a lack of powerful leg movements. Subtle changes in gait can allow continued mobility. Kyphosis, also known as hunchback. This is a condition in which the spine in the upper back has an excessive curvature. Kyphosis can cause symptoms such as difficulty breathing and trouble performing tasks like walking. Kyphosis also affects balance. Individuals with this disease are at an increased risk of falling. When kyphosis is present, outward signs that may be observed include difficulty getting up from a seated or lying down position and walking more slowly. The elder woman in the video appeared to be suffering from this disease and displayed these signs and symptoms. Walking pattern in late adulthood tend to change as a result of changing individual constraints and physical limitations. Balance is affected by the natural aging process associated with bone and muscle loss. Lean muscle atrophies, long bones become more brittle due to mineral loss, joints become stiffer and less flexible, and degeneration of cartilage between bones occurs. However, a disease state must progress to a critical level before it will discourage all walking. Older adults are able to modify and adapt changes to their gait to account for pain and changes in balance.